So February is known as Heart Health Month. And while we are a physical therapy practice, and we don't typically deal with the common heart health issues that you might think of during a Heart Health Month awareness. We are a holistic physical therapy practice at R3 Physio, and we do use a treatment approach called visceral manipulation, meaning we look at and take into account how the fascial surroundings of the viscera or the organs relate to a lot of the musculoskeletal issues that we see brought into a physical therapy practice. And so a lot of times, just in general, what we see is traditional musculoskeletal pain. So things like hip pain, neck pain, back pain, shoulder pain, knee pain, headaches, TMJ, things like that. Often, when they don't respond to a more traditional approach, we find that there are deeper rooted issues, and that can be related to those fascial restrictions. And so, the way that our bodies are designed is that they are going to protect what's most important. So, an artery, an organ, a nerve, those things are more important than a muscle, a joint, a disc. And so, if your body's put into a position where moving a certain way or performing a certain function will put any of those more vital structures in jeopardy, it's going to find a way to protect that. Sometimes that looks like stiffening up through muscles. It can look like muscle spasms. That can look like changing the way you move, which then can lead to more stress and strain on other areas because now you're moving in a way that is different than how your body was efficiently designed. And so the different tissues, different joints will take on more stress. And so a lot of times we have to go in and find those deeper rooted issues. And so what we're going to talk through is how the heart and the lining of the heart, the pericardium, can play into some of those. But first, what we need to do is talk about the role of fascia. Fascia has gotten a lot more awareness over the last few years. But I think for the most part, unless you're in that world, you probably haven't heard a whole lot about it. And so the way that I describe fascia to people is it's like when you peel an orange, there's that white thin layer around the fruit just underneath the peel. That's like the thin layers of fascia that we have just underneath the skin. And then you've got the little divisions between the orange, and that's like the deeper layers of fascia that go and surround our muscles, our organs, our muscle fibers. And all of this fascia is connected. It's all formed from the same layer when we are developing in our mother's womb. It all develops from what's called the mesoderm. And so that means that all these fascial layers are connected. They're not different and separate fascial layers. So right there, that tells us that there are connections from head to toe, from front to back. And so one of the roles of fascia is that it's a connector and it's a communication channel. It communicates force as it goes through our body. So as we have traumas, physical traumas that enter our body, fascia takes that force and it distributes it throughout our bodies. If our fascia is healthy, it can distribute that force a lot better. If we already have vulnerable areas from past injuries, we'll tend to see those vulnerable areas more likely to flare up from those increased forces because now as that force comes in, it's going to travel only up to the point where we have this previous trauma and that fascia is maybe thickened up and can't continue to distribute that force as well. So it's a communicator, it's a force distributor. It's also a container. It plays a role with just holding contents. It also plays a role with fluid exchange, moving fluid, lymphatic fluid, um, circulatory fluid, so blood in and out plays a big role with that because fascia also surrounds our vessels, our arteries and veins. It can help with hormone regulation. It has a role in the nervous system. So the majority of the nerve fibers that come into fascia are innervated by the sympathetic nervous system. So that's the fight or flight side, fight, flight, or freeze side of our nervous system. And so when our fascia is more tense, we may seem to be more in that fight or flight response, or vice versa, when we're in that fight or flight response, maybe because of a stressful situation, an emotional event, we may feel stiffer because that fascia is responding to those nerve endings, sending those signals. The flip side of that means that when we are healthier as far as our fascia goes, we are better able to get into a parasympathetic state that rest, digest, and heal, which is why body work and fascia work can be such a benefit. It also plays a role in the immune system. So fascia has been shown to store viruses, bacteria, particles, fungi, things like that in our body, almost like a protective mechanism. It stores these little particles, uh, and that keeps them sometimes from circulating. But what that means is that they can be released. So if you've ever had, say, a real deep tissue massage, and after it you felt like you were hit by a truck, almost like those flu-like symptoms, that can be because those stored particles were released into your system, and now you have an immune response ramping up to those particles. It doesn't mean you're sick. Your body may not be able to deal with it, and maybe you do end up getting sick, but it doesn't necessarily mean you're sick. It just means your body has a ramped up immune response to something and it needs support. And so there's a lot of roles to fascia. So when we're working with these structures, we often will see the different systems of the body affected, even though what we're going in and doing is looking at the motion, the movement. We often will see these other systems of the body, which is why we describe ourselves at R3 Physio as systems-based physical therapists. So let's get in a little bit to specifically the heart, since it's Heart Health Month. So the heart has a lining that surrounds it. It's a fascial lining. It's called the pericardium. And the pericardium has 5 ligaments. And I'm going to show you these ligaments. So this is the heart. The green is the pericardium. Just to orient you, this is the back side. This is the front side of the body. So this is the sternum. This is the chest bone right here. So the heart, the pericardium, has 5 ligaments. We've got one right here at the bottom. It's attaching to the diaphragm. It's called the phrenico-pericardial ligament. We've got 2 that attach to the backside of the sternum, one down lower here, the inferior sternopericardial ligament, and one up higher, the superior sternopericardial ligament. And then we've got 2, one on each side, left and right, that comes up and attaches into the lower cervical spine. That's the vertebropericardial ligament. So when we are looking at visceral mobilization techniques, we are looking at affecting these ligaments specifically if we're targeting the pericardium. There's also some fascial connections. You can see the proximity to the back side of the so the front side of the spine, but to the back side here of the thoracic cavity. So there's definitely a connection here to a close connection to the thoracic spine. The other thing that's interesting to note is that, remember I mentioned that that fascia is continuous. It's all developed from the same layer. So if we were to follow these layers up, what we would find is in the cervical spine, there is a layer of fascia called the middle cervical fascia. That cervical fascia, that middle cervical fascia comes down from the neck, and it comes down, passes the thyroid, and then comes and joins with the pericardium. And then that, I'll show you another image here. And these images, by the way, these are taken from a book called The Fascia by Serge Paolotti. Great book, lots of great diagrams. So we've got this middle cervical fascia. And so it's got connections to this more superficial fascia that we talked about. But if we were to trace it down, it goes into what's called the endothoracic fascia. So that brings us into this thoracic cavity that has connections to the pericardium, which is what we're talking about, that ligament down to the diaphragm. It's got connections to the lungs. If we were to continue to trace that down, that brings us into what's called the transversalis fascia. That's in the abdomen. So that's going to be continuous with the transverse abdominis, some of those deeper abdominal muscles, which then comes into the perineal fascia, which brings us into the pelvis. And so there's this connection all the way from the neck down to the pelvis. And we can include the heart as part of that. And so when we are treating these visceral structures, and in this case, the heart, these are all potentially areas that are going to be affected. You can even see on this diagram, we got upper limb, we've got lower limb. And so even potentially issues in the limbs can be affected by this. So when we are treating the heart, we keep that in mind. But a lot of times, what we might see with the heart and what would bring people in and make us think heart is things like thoracic pain, so mid back pain, pain between the shoulder blades that is maybe consistent, doesn't go away with traditional treatments, or maybe it keeps coming back. Neck pain because of those connections. We might see shoulder pain because of some of the connections to the thoracic spine and to the thorax, to the rib cage, and how that causes our shoulders to move. From an Eastern medicine standpoint, there are some acupuncture points or meridians that go underneath the shoulder into the armpit area that are related to the heart. And so we've even seen things like frozen shoulder have a connection to the heart. We may see issues with the airway and breathing related to restrictions in the heart because of that connection to the diaphragm, that ligament that comes to the diaphragm. We may see vagus nerve issues. So that could be dysautonomia, which means a dysfunction in the autonomic nervous system. Autonomic nervous system being made up of the sympathetic nervous system and the parasympathetic nervous system. Probably the most well-known one that people are aware of is POTS, postural orthostatic tachycardic syndrome. So this is an issue where people's heart rate suddenly raises, they get episodes of fainting. There's sometimes some circulation issues. A lot of times this goes hand in hand with people that have Ehlers-Danlos. We've seen this triggered by recent viruses in the last few years, recent injections in the last few years when people's bodies don't respond well to those. Those things can affect the heart and be affected by treatment of the heart. So our patients that have had dysautonomia, we've seen them respond well to some of these treatments. Also, the heart and circulation. And so as we treat some of these structures, inevitably, when a structure doesn't move well, it's not going to function at its most efficient. And so a lot of times what we see is as it starts to move better, we start to see changes in how it functions. The heart, a big role is circulation and pumping that blood. And so if there are circulation issues or even swelling, lymphatic issues, things like that, we'll start to see things change. So maybe that means less swelling. Maybe that means, so for men that maybe have erectile dysfunction, maybe that means we see a change in that because now all of a sudden the body's getting better circulation. And oftentimes that can be a circulatory issue. We also see when people have some heavy emotional trauma. So think about when you have heartbreak. A lot of times those things will affect the heart, and we have visceral reactions. Our organs, our fascia respond to emotions. And so when we have those gut reactions or those visceral responses, sometimes you'll even feel like where you tighten up, you feel this pressure maybe. That can be the fascia tightening. And that's normal. That's our body's way of functioning. But if that is an overwhelming event that your body and your brain can't handle, or if it's an ongoing event that you're constantly under, then we might start to see changes, and that can lead to some of these other issues. So just to pick this apart a little bit more, um, with the heart and the vagus nerve, for example, the vagus nerve is one of our cranial nerves. It comes off of the bottom part of the brain, and then comes down around the front of the neck, comes down, and then goes by the heart. And so, and it's got fascia that surrounds it. And so if it's gotten restricted, say from whiplash, or if it's gotten restricted from postures. Maybe we hold ourselves a certain way. Maybe we're constantly talking on the phone. Maybe not as much these days because we don't have handheld phones as much, but still people hold their phone up. Um, Maybe we just had a gentleman not too long ago that for whatever reason his fascia that surrounds the sheath that the vagus nerve runs in got adhered, and he all of a sudden would get headaches when he was exercising. Had never had it before, but all of a sudden it started. Everything else checked out, blood pressure checked out, heart rate checked out, like all the vitals were good, but this kept consistently happening. Freed that up, and he's been good since. And so things like that um, can be affected, but they can also be treated. Um, Oftentimes with pregnancy, as baby grows in the abdomen, it starts to push structures away. And that's going to also affect how well as you breathe in, diaphragm's usually going to drop down. But if you have baby growing and pushing up against the diaphragm, it's not going to be able to drop down. Movement is what helps keep our fascia healthy. And so if you can't move through a full range, that means you're not going to be able to continue to keep that tissue hydrated. So now we've got this shortened range. And when baby's delivered, your body doesn't necessarily always go back to how it was. And so you might continue to have this learned pattern, these tightened fascial restrictions. And so then our mamas that have given birth, we often will see lower and mid back restrictions. We might see issues with taking deep breaths, and that breathing pattern changing to be more shallow. And so then we start to see thoracic issues. We start to see neck issues, shoulder issues from that. And so these are the kinds of things that we look at. And so as a holistic physical therapy practice, being that we're in February and we're looking at Heart Health Month, this is how we look at Heart Health Month. It does not mean that we treat the medical conditions that come with heart health that you need cardiologists for. But if you're somebody that is more proactive in taking care of their health, or if you're somebody that has these lingering issues, these are the kinds of things that we look at.